All right. Okay. So welcome. Today we're going to talk about Medicare. You got myself. I'm David Adams. I'm sure most of you are clients if you're on here. If not, nice to meet you virtually. I've got Miles, who's also another wealth advisor on my team, and we try to do a bunch of these type of value add events outside of just talking about the stock market and wealth management. Part of that is, we have nutritionists come and speak about nutritional health and wellness, and a topic that's Social Security. We did one on just a few weeks ago, but we get a lot of questions on Medicare and enrolling for Medicare, whether it's yourself or parents or friends, et cetera. Supplemental policy, all the things that go around Medicare. We get a lot of questions on that. And we don't claim to be Medicare specialists. We know enough to be dangerous, but what we try to do a good job is go out and find professionals that can work with our clients to make sure they get their questions answered and get enrolled successfully. And through that process, we have Summer Hancock here today. She's local. She's here in Brentwood, Tennessee, but she spends her time doing this, working with financial advisors and big corporations, helping their employees and our clients get enrolled in Medicare and kind of make it less scary. So I'm going to turn it over to her. Summer's has a presentation. We're going to do Q&A. So at the bottom of your screen, you should be able to ask questions, type those in along the way. And then Miles, kind of towards the end of her presentation, probably in 20 minutes or so, he's going to facilitate if there's any questions on there. He's going to ask them. Summer will answer those real time. But most importantly, she's going to provide all of you with her contact information. And so if you're on this call, if you're a client of ours, or you're listening to this, you're able to reach out to her, and for no charge to you, she can help you with your Medicare questions. So hopefully that's helpful. And we're also going to record this and then send it out as a replay as well. So you'll be able to see this different ways, or if you want to share it with friends or family. That being said, Miles, did I miss anything?
I don't think so. I think it's just this is one of those areas where it can be very complex, and it's nice to work with somebody who's knowledgeable and knows the landscape so that you're making informed decisions and not guessing at what the best coverage is for you. I think one of the most important things is you want to make sure you're able to keep the same doctors you've probably been with for years on that plan. And so working with somebody knowledgeable is what you want to do when you're moving into this next chapter.
Great. Good points. All right. So I'm going to turn video off. We're going to let Summer have the stage, and thanks for being here. We'll talk soon. Okay.
Thanks, David. Thanks, Miles. And I appreciate you guys having me today. Again, I'm Summer Hancock. I'm a licensed independent health insurance broker, and I've been doing this for 13 years. Prior to that, I was in the healthcare IT world. And then prior to that, I was a pharmaceutical rep. So I called on physicians, hospitals, hospital pharmacies, and local pharmacies. So I'm well-versed in the pharmaceutical world. I know how important the cost of your prescriptions are, and that's really helped me now to become an advocate for you to help keep your prescription drug costs down. I'm going to go ahead and share my screen. Let's see. Can y'all see that okay? Do y'all see my presentation?
It is not showing up yet.
Not yet? Okay.
Yep.
All right. Let me try this again. Okay.
There we go. It's up there now, Summer.
It is fantastic. Thank you so much. Okay. So you're welcome to take a screenshot or take a picture of this. That says my email, summercanhelpyou@gmail.com, as well as my cell phone number, which is 615-403-5343. And like the guy said, I'm a broker, which means I represent all the major carriers. I'm licensed all over the country. My services are always free. My clients never send me money. The insurance companies pay me a commission if you enroll. So, and I'm here to help you. I'm very passionate about helping folks with their health insurance needs, how to get on Medicare, if you should go on Medicare, and when to go on Medicare. Lots of things to talk about. So I will share this information here again towards the end. So on the agenda, we're going to talk about the 4 parts of Medicare. There's A, B, C, and D. We're going to talk about what your options are as far as health insurance and whether you should go on Medicare or not and the timing of that. And then we're going to talk about prescription drug coverage as well as the enrollment and eligibility times that you can enroll. So Medicare Part A is your hospital coverage, and we're going to get this from all the years you have worked. So as long as you've worked 40 quarters or 10 years, pay taxes in the United States, you have earned Medicare Part A. So it's not free, it's earned. So that's a good thing. Medicare Part B is your medical. And Medicare Part B covers a lot of things. Most commonly is going to be your doctor's offices, or if you needed blood or durable medical equipment such as oxygen or a CPAP machine, or if you needed chemotherapy or special injections, those that fall under Part B. And Part B does have a premium, and I'll explain that in the next slide. There's Part C of Medicare, which is a type of health insurance that you can choose from. There's only 2 types, and this is one. And this is with, they're called Medicare Advantage plans. And then Part D, that one's easy to remember. That's for prescription drug coverage, Part D. So this slide shows if you did not have any type of supplement or advantage plan to go with your Medicare, you just had just plain A and B, you would be subject to a Medicare Part A deductible as well as a Part B deductible. And then you'd pay 20% co-insurance for all your services. That's including the hospital. That's why it is so important that when you go on Medicare, that you choose a health insurance option to go along with it to help pay your cost at the hospital and at the doctor, and as well as your prescription drugs. So the Part D premium is roughly $30, but that's just an average, national average. They go as low as $0 a month here in Tennessee, especially. And then at the bottom of the screen, the take home here is that original Medicare, which is Part B, one of the parts, is $185 a month. Okay. Now, depending on what your income is, you may pay more than $185. And that's what this slide is about. Very important slide. If you're a higher income earner, this slide is very important to you. And this is something I can also share with you. We call this IRMA. It stands for Income Related Monthly Adjustment Amount. And it's going to show you how much Medicare is going to charge you if you earn more than the average American for your Medicare Part B and then your Medicare Part D, which is your prescription drugs. So if you're, for example, if you and your spouse are drawing $250,000 a year or making $250,000 a year in gross taxable household income, then you would pay an additional $74 for your Medicare Part B and $13.70 for Part D, just to kind of give you an example of how this chart works. What is also really important about IRMA is if you are a higher income earner, and let's say you decide to retire and your income goes down, and maybe it goes down a tier on this form, then you're going to want to let Social Security know, because the IRS looks back as far as 2 years on your gross taxable household income. And they're going to say, okay, wow, they made this amount of money, we're going to charge them extra. And you don't want to do that. So you fill out this IRMA form, hand it to Social Security, and that way, and not overcharge you for the next 2 years. Very important. And it's also important to fill out this IRMA form to hand it to Social Security. My tip is ask for a receipt that you left it with them. If they will not provide a receipt, sometimes they'll stamp the date on there, take a picture as proof that you left it with them. I would not mail this form in. So, but anyway, and you're welcome to call me with more questions about this. I'm happy to answer for you guys. Also, some things to consider are going to be, how much can you afford? You know, we want to budget that. That's where I come in, is I can help you with that. And even if you're thinking about retiring years down the road, I can run a quote for you and give you an estimate of what it would cost. That way you can plan accordingly. And then you want to look at what do the insurance plans cover? Are they going to cover all your needs? Like Miles said, you want to keep your doctors, and I want you to keep your doctors too. And then we talk about the travel. So if you like to travel outside the country, Medicare does not cover you when you leave the United States, but a lot of insurance companies do. So that's fantastic. So here are your 2 options when you decide to go on Medicare for health insurance. Both options are going to take excellent care of you if you were to get sick or injured. It's just a matter of, do you want to pay as you go, or do you want to pay a monthly premium? So option number 1, I call that a pay-as-you-go plan. That's a Medicare Advantage plan. And those are going to cover A, B, C, and D. They're going to cover your hospital, your doctors, your prescription drugs, amongst many other things. Typically, about 99% of the plans out there do not have a monthly premium. You still pay Medicare, or excuse me, you pay Social Security for your Medicare Part B, always, once you're on Medicare, but there's no additional cost monthly to have a Medicare Advantage plan. So that's a very cost-effective option for a lot of people. Option number 2 is a Medicare supplement. Medicare supplements do have a monthly premium. Here, I would say here in Middle Tennessee, the premiums are about $120, give or take, for a 65-year-old. They do cover your doctors and hospitals. They pay super well, and you can see any doctor you want to in the country as long as they accept Medicare. They do not cover prescription drugs, so you do have to buy a separate drug plan to go along with your supplement. And that's something that I can help shop for and help you buy. So the Advantage plans, they're called Part C. You'll hear that on commercials. And speaking of commercials, I would ignore 99% of those. They're just trying to get you to call in, and then they'll call you back. But the Advantage plans, they do cover Part D, like I said, and they also offer many other bells and whistles, which I'll go over here in just a moment. So the Advantage plans have HMOs and PPOs. So most HMOs require a referral from your primary care doctor to see a specialist, but not all of them. But the good thing about an HMO is that your doctors are going to work together and coordinate as a team to make sure you're getting excellent care. So make sure you're not having lab work done that you just had done, no repeat test, and they work together to ensure that you're getting excellent health care. PPO plans do not require a referral from your primary care doctor to see a specialist. You have a little more flexibility with that. Some other advantages to a Medicare Advantage plan are going to be, they do cover you if you leave the United States. You have worldwide emergency room coverage with these plans. So if you fall and break your leg and you're in Mexico, you go to the nearest emergency room, you present your insurance card, and they will take care of you. So you have a little more peace of mind in case you like to travel internationally. They do offer vision and hearing, dental, prescription drug coverage. So what I mean by that is they typically give you an allowance that you can use at the dentist. That covers your cleanings. It will cover like a root canal or a crown, dentures, things like that. So you do get quite a nice allowance to spend at the dentist. They also do the same for glasses and contacts. You also get an allowance to spend there. And then all the Advantage plans do offer free gym memberships to health clubs and gyms. And so I think that's a nice little perk of being a member of the insurance companies. And then they do offer over-the-counter benefits. That's what the OTC stands for. So that's the items you're going to see outside the pharmacy area. They give you an allowance that you can buy all those things, which could be vitamins, eye drops, different allergy medicines, things that people need on a daily basis. So a lot of bells and whistles when it comes to the Advantage plans. And here are some pros and cons. So the pros are going to be the little to no monthly premium. They do cover prescription drugs, the dental, vision, and hearing benefits. And they also give you allowances for hearing aids, or they'll give you a really low copay for a hearing aid because those could be quite pricey. And they do have max out-of-pockets. So no matter how sick or injured you might become, there's X amount that you cannot go over. If you ever reach your max out-of-pocket, the insurance company and Medicare are going to pay for all of your covered hospital and doctor-related expenses. So you do have a safety net there, knowing that you have a max out-of-pocket. Cons would be, they do have networks, and so that's why it's so important that I look up your doctors, including your dentist and your eye doctor, to make sure they are covered by the insurance companies. Very big deal. And some insurance companies will cover out-of-network doctors too, so there is a little safety net there as well. The costs are not standardized like Medicare supplements. Supplements are just a totally different type of insurance, and we'll go over that here in a moment. It says restrictions for those that travel. I'm not sure why this is on here, and I'm not allowed to change this slide because it's Medicare approved, but you've got worldwide coverage in any ER in the world, and you've got urgent care coverage here in the United States. So you can travel knowing if you were to get sick or injured, you've got the care you need when you need it. And the benefits can change from year to year. So a lot of competition with these insurance companies. They're trying to outdo each other. Okay, so now we're going to change gears to the other option that you can choose from when you are on Medicare. And these are called Medicare supplements. And this used to be the only option you have when Medicare started in the 60s. So Medicare supplements are going to cover Part A and B only, which is hospital and doctor, like medical coverage. So they pay really well. I'm going to give you an example. If you were to go in the hospital and have open heart surgery, you would not get a bill. And the reason why is because Medicare is going to pay 80% of your hospital bill, and the supplement pays the other 20, which means you don't receive a bill. And then the only deductible on a supplement is going to be is $257, which most people reach that at their first doctor visit. Now, the beauty behind these plans is you can see any provider in the country as long as they accept Medicare. And your insurance is going to cover anything Medicare would cover. So the loose definition to Medicare cover is going to be due to an illness or injury. Okay, so no cosmetic. And so they do pay very, very well on these plans. They do have monthly premiums, though. And I want to go back to this slide again. They do have monthly premiums, and you do buy a drug plan to go along with it. But I will say what is also important about supplements when you're new to Medicare is that you are guaranteed to get a supplement. There are no health questions asked. They cannot rate you based on pre-existing conditions. You are guaranteed to get it, which is fantastic. And the supplement prices do go up as you age. They all do. And it's not a huge jump. It's just they kind of creep up as you age. So I always let folks know that as well. But the supplements do, like I said, they pay really well. Now there's prescription drugs. We're going to talk about that. That's also called Part D. So you want to make sure your drugs are covered, or what your out-of-pocket costs are going to be, and what pharmacies can you go to. And that's something that I collect from you. I'll just send you a link. You fill out the form, and I can shop pharmacies for you. You'll be shocked at how much you can save from one pharmacy to another. And I will shop all the pharmacies. I look up your prescriptions. And that's the first thing I actually do, because that's your fixed cost every month. We want to keep that as low as we can, because a drug is a drug, and I want to make sure that you can get your prescriptions at the lowest price. I'm very passionate about cost. I want to keep your cost down as low as we can, but still get excellent health care, and it can be done. So prescription drug plans, also called Part D, they do have formularies. They do have tiers, very similar to what you've probably had in the past with employer insurance. And so they have generics, they cover brand names, and they have to cover prescription drugs on every disease state for generics and brand names. And so I'm going to talk a little bit more about drugs on this slide. So there were really big changes with Medicare Part D this year, and it's good news. So those of you that are familiar with the donut hole, Medicare has done away with that. And so now they are capping Medicare beneficiaries at $2,000 on prescription drugs. So more than likely, you have to be on multiple brand name medicines to even come close to $2,000 out of pocket for your medicines. But if you were to reach that in a year, you're capped, which means Medicare is going to require the insurance companies to pay for all of your covered medicines the rest of the year. Also, what is new is Medicare is requiring the insurance companies to offer you a payment plan. So you can opt in at any time. You don't have to be at $2,000. You could be at $200. And you have a payment plan. You just call the insurance company, and you've got 12 months to pay off your prescription drug bill. So they're really helping folks. They're also doing price inflation controls too. And they're also trying to work on getting the most expensive drugs at a lower cost. So there's a lot of negotiations going on, and I think it's only going to get better for what I'm seeing. So how do you enroll in Medicare and your initial? So when you're turning 65, you've got 3 months before your birthday, the month of your birthday, and 3 months after your birthday to enroll. So you have 7 months. Also, people that have been on disability on the 25th month, they can go on Medicare. So if you know folks that are on Medicare and they're in their 40s or 50s or or even 20s, it's because they've been on disability. Now, whether it's right for you to go on Medicare is something I can help you with, because if you have a spouse or dependents that are relying on you for health insurance, usually it's best to stay on that employer plan, okay? If not, I will do a cost analysis for you, because if you're having to pay that IRMAA that we were talking about earlier, sometimes it's best to stay on employer insurance. And the numbers will speak for themselves, and I'm happy to do a cost analysis for you for that. I'd say the majority of folks go on Medicare because, one, it pays really well, and two, it's usually a lot cheaper than employer insurance. So what is also very important, and when you're trying to decide going to Medicare, is to find out if your current plan is considered credible coverage, because if it is not, you'll pay a penalty for not having credible coverage. And you're welcome to reach out to me. I'll explain more about that. And then you've got that 7-month window when you're turning 65 to enroll in a Medicare plan. And you can have a late enrollment penalty if you go longer than 63 days without credible coverage. So that's where I come in, as I hold your hand through the whole process. And to enroll in Medicare, there's 2 ways. The easiest way is to go to the Social Security website, which is ssa.gov. If you're older than 65, say you're 68, okay, you're not new to Medicare necessarily, you're 68 years old. What is really important is that you get what is called a letter of credible coverage from your employer, stating that you've had credible coverage from the month and the year you turned 65 up until now. And that letter is something you're going to upload along with your Medicare application on the Social Security website. Very important. And I can also provide that form for you guys. The second way is just to go to the local Social Security office, but I would call ahead because they do, require appointments sometimes, and the appointments are usually about a month out. So just heads up there. When can you enroll? Let's say you're already on Medicare, you got your insurance. You can change your insurance once a year if you'd like. Your open enrollment is going to be October 15th through December 7th of every year, so that doesn't change. Now, this is a little secret that is not advertised. This is an open enrollment period where if you're already on a Medicare plan and let's say you don't like it, or you have buyer's remorse, you wish you would have enrolled in the other one, or you want to go back to your old one, lots of things could happen, and that's okay. And Medicare is recognizing that. And so they've offered this little window from January 1st through March 31st where you can change your plan one time. And that's something I can help you with. So I just love this. I think this is great. And you will not see this advertised. You only hear about it through your broker. And then there's my information. I'm going to hand it back to Miles in case we have any questions.
Yeah, thank you, Summer. That was great. There was just one question. I think when you were talking about the IRMA and the form, your video froze just for a split second. So somebody was asking if you could just repeat the instructions on really what to do with that form and maybe how to file it.
Yes, I have that form, and I'm happy to email it to whomever. So the form, you want to fill it out. Basically, if you've had a life-changing event with your income, like if you retire or your income goes down, or maybe your spouse retires and your income goes down, you want to fill this form out because otherwise the IRS is going to look back as far as 2 years on your income, and you don't want to overpay for your Medicare for the next 2 years while it catches up. So that form just lets Social Security know, hey, we're not making that amount of money anymore, so don't overcharge us. And that's what that form is for. It's very important. And each person, so if you and your spouse need to fill it out, you would fill them out separately too. That's really important.
Okay, thank you.
Yeah.
Another question. I don't think you touched on this, but HSAs, how did those come into play with Medicare, and are you able to use those for anything?
Yes, great question. Okay, so if you do have an HSA, you do want to stop contributing 6 months before going on Medicare. And you can also use your HSA funds to help pay for certain Medicare premiums. And it just depends on what insurance you have, but you can use them, which is great. Good question.
Thank you. Another question here. So I turned 65 in August and have already received a credible coverage letter. I'm sole on my insurance at work. Should I switch to Medicare?
It depends. It depends if you have a spouse or dependents that rely on you for health care. If you don't, and I can run a quote for you. And usually it's a lot cheaper to go on Medicare and you get much better coverage. And the reason why is because you've been paying in Medicare taxes your entire working life. And these plans are really designed to take care of you now. And you don't have a several $1,000 deductible on any of these plans. So that right there in the premium is usually why most people go on Medicare when they can. But I'm happy to run a quote for that person, and that way they know they're making the right decision.
Okay, perfect. Long-term is more of a question I have for planning purposes, but long-term care insurance, I don't believe that's covered under Medicare. Is that accurate?
It's not. I wish it was. I wish it was, but it's not. They don't cover long-term care, unfortunately.
Okay, perfect. Don't see any other questions at the moment. Give it just maybe a couple seconds here to see if anybody has one.
Okay.
Oh, one just popped in. How does prior authorization work with Medicare?
So it depends on what your service is. Whether you got to have prior authorization, it depends, like if you're going to have a surgery or it really, that's a very broad question for me to answer. Um, it's usually for the more expensive things, like if you had to have chemotherapy or certain surgeries or certain tests, things like that could have a prior authorization. It really depends on the service, honestly.
Awesome. Not seeing anything else here. Again, we're gonna get this ready and send out as a replay, and there's Summer's contact information right there for anybody who wants to reach out to her, or if you want us to help coordinate, we're happy to put you in contact with her also. But thanks everybody for joining us today. And Summer, do you have any last comments?
That's how I'm happy to help you guys however I can. I love to help people, so you're in good hands.
Awesome. Well, thanks again for joining and for doing this for us and our clients today. We really appreciate it, and hope everybody has a good rest of the afternoon.
All right. Thank y'all. Appreciate your time.
Any opinions are those of myself and not necessarily those of Raymond James. Expressions of opinion are as of this date and are subject to change without notice. The information contained in these podcasts do not purport to be a complete description of the securities market or developments referred to in this material. The information has been obtained from sources considered to be reliable, but we do not guarantee that the foregoing material is accurate or complete. Every investor situation is unique, and you should consider your investment goals, risk tolerance, and time horizon before making any investment. Prior to making an investment decision, please consult with your financial advisor about your individual situation. Any hypothetical examples are for illustration purposes only. Actual investor results will vary. Raymond James does not provide legal or tax services. Please discuss these matters with the appropriate professional.